Okay, so this semester we researched if in patients with moderate to severe risk of impaired skin integrity, if pressure relieving interventions compared to no pressure relieving interventions reduce the risk or incidence of skin breakdown. Impaired skin integrity is something we often see in adult patients, especially those with sensory or cognitive deficits, poor nutrition, limited mobility, or increased moisture exposure, and particularly in individuals who need help with transferring. We also know that chronic conditions like vascular disease and diabetes put patients at higher risk, as these diseases compromise perfusion and the circulatory system. Impaired skin integrity is more than just a surface level issue. It increases the risk of infection, can limit mobility, and can significantly reduce a patient's functional ability. In some cases, these complications can progress to the point of limb loss, and in the most severe situations, even death. Now, when we talk about impaired skin integrity, we often think of changes in the epidermis or the dermis, but it's important to remember that this problem isn't limited to just the skin surface. It can also occur in areas such as the mucous membranes, the cornea, and throughout the integumentary system. Patients in the hospital are at a higher risk for skin integrity problems. This is often due to a combination of factors like immobility, increased moisture, and underlying health conditions that they may already have upon admission. This issue drew even more attention in healthcare when we learned that most pressure injuries are actually preventable, yet they remain costly and are linked to longer hospital stays. We conducted our literature review using the PubMed database through the University of Nevada, Reno libraries. We focused our search on key terms like pressure injury, nursing interventions, skin breakdown, and bed sores. To make sure we were looking at the most relevant and reliable information, we applied filters for peer review articles published in the last 5 years with full text access that included randomized control trials, systematic reviews, narrative reviews, and quasi experiments, cohort studies, and expert opinions, all specifically related to pressure relieving nursing interventions in hospitalized adults. We then appraised each article's strength of evidence using the levels of evidence outlined in Essentials of Nursing Research from Lippincott CoursePoint. High quality studies, classified as levels 1, 2, 3, 5, and 6, addressed our research question, looking at how pressure relieving interventions compare to no interventions at all, and provided a holistic, objective view of how these strategies can reduce the risk of skin breakdown. So our results. Our review found strong evidence that repositioning patients every 1 to 2 hours and using supportive devices in the bed significantly reduces skin breakdown. Early nursing interventions, such as physically repositioning the patient or providing education, lower the incidence of skin damage. The key here is tailoring prevention to the individual patient and evaluating their needs case by case to determine the most effective strategies. Certain risk factors like age, sex, and chronic illness increase a patient's likelihood of developing pressure injuries. Education programs on the Braden scale and wound care protocols not only help nurses understand the importance of prevention, but also improve their skills. In one study, prevention care bundles, which included strategies like air cushions and specific positioning techniques, prevented over 90% of pressure injuries. Looking at specific device data, patients using air mattresses had fewer new stage 2 through 4 pressure ulcers compared to those using alternating mattresses, 5.2% versus 11.7%, which was statistically significant. They also went longer before developing ulcers, 10.5 days versus 5.4 days, and had a lower incidence density. Repositioning every 2 hours also showed measurable benefits. The average Braden Q score before intervention was 16.77, and it increased to 18.47 after implementation, indicating improved skin health and reduced risk. When it came to mattresses, patients on pressure relieving mattresses had a lower risk of early skin changes, like blanching erythema, with rates dropping from 26.3% to 19.9%. Over a 7-day period, both blanching and non-blanching erythema showed even stronger statistical significance. By contrast, patients on standard mattresses were 36% more likely to develop skin damage. Finally, perioperative protection and pressure relieving devices were effective in preventing hospital-acquired pressure injuries. Preoperative measures included educating patients, performing risk assessments, and applying silicone foam dressings. Intraoperative strategies focused on maintaining hemodynamic stability and normothermia. Post-operatively, early mobilization and continued use of pressure-relieving devices were emphasized. After implementing a full HAPI prevention care bundle, incidence rates dropped from 4.8% to 1.6%. Now, skin integrity is a growing concern across healthcare settings because when it's compromised, it can lead to serious outcomes like infection and tissue necrosis. To combat pressure injuries, hospitals implement a range of interventions aimed at promoting circulation and preventing ulcer formation. One of the most important strategies is early detection. Nurses perform skin checks on every patient at admission and repeat them if the patient has been away from the unit for more than 2 hours. The first step in prevention is identifying early warning signs and addressing them immediately. Routine turning every 2 hours is another cornerstone of prevention. This simple measure redistributes pressure and prevents prolonged stress on one area. For patients who are incontinent or have high moisture areas like skin folds, barrier creams are applied to protect against breakdown. Physicians can also order pressure-relieving devices such as specialized beds or waffle pads to reduce pressure on bony prominences when patients are lying in bed or sitting. These measures have been shown to reduce the frequency of pressure ulcer formation. Pressure ulcers not only affect the patient's quality of life, but they can also progress into serious wounds that require advanced treatment. While some prevention strategies have an upfront cost, they save money in the long run by reducing complications, shortening hospital stays, and preventing the need for extensive wound care.